My father's a physician, so I believe that when I was born, that's what I was told I was going to do, and I was never given the chance to change my mind. When I came to the United States, the prime goal was actually to become a bone marrow transplanter, and that is when I sought out residencies and fellowships for that. I landed up at Indiana University to meet Larry Einhorn, in which he said, go ahead and look at bone marrow transplant in people with germ cell tumors, which is the most chemosensitive tumor that we know about. And I remember when the results came out, he said, listen, this is the most chemosensitive tumor we know, and only 60% of patients are survivors. Maybe the future of treating and caring of patients is having more targeted therapies. And from there on, my interest shifted from being a bone marrow transplanter to being more of a medical oncologist.
Dr. Bhatia is very deserving of anything that is community focused. That's what he sees himself as a community physician, somebody who's available to anybody and everybody. Dr. Bhatia is the most accessible person, the busiest person I know, and yet the most accessible. The person that I hear from patients over and over again, they called him as a referral and he wanted to know if they wanted to be seen today or tomorrow. How does that happen? How does the guy who is busier than anybody always have time, and every single patient believes they're his only patient? I can't explain it, but that's what makes him community. I'm not talking about Community Health Network, I'm talking about community. I'm talking about anybody, anytime, anywhere. That's Sumeet Bhatia. He's very special.
Being a community physician and taking care of our patients in the real world in a way that they can get state-of-the-art care without having to travel outside our state and outside their communities essentially means that they have a better quality of life, spend more time with their family rather than physician offices. That's the goal of what we do. The goal of medicine is to enhance life. My hope would be that we come to a point, and my legacy would be that because of what I've learned and because we learn how to deliver it, patients spend less time thinking about cancer and more time getting on with their life.
When I provided my letter of support for Dr. Bhatia, I mentioned the Sumeet way. And that's how I've explained Sumeet to others. Here's this person who is interested in whatever you have going on. And I mean, clinically or not clinically, he's interested. He wants to know all about it. He wants to learn from it. He wants to help you from it. And then when you put the Sumeet way into our organization, that we require, we train, we hope to all become servant leaders. He's the poster child of a servant leader. Because all of our conversations are focused back on patients. And his way is to make sure that somebody can go through this journey, this awful journey that nobody wants. And when it's all said and done, that everybody knows how much we personally care. That's Sumeet Bhatia.
To be recognized by my alma mater is probably the greatest honor of my life. For an immigrant to come here to Indiana and be recognized as a Hoosier, thank you for that.